Hello everybody, I'm your flight physician. Today I will share you a part of drama series. It is called House. It is tremendous. It was popular medical drama, and it has shown different aspects of medical issues. And Dr. House, he was very much famous then with his beautiful presentation as an actor. So I'm quickly going to the issue today. I'm going to share. It is about a case that has been dealt by Dr. House, who was returning to his residence area from medical. It is called medical programs, I think. So you are traveling through the air, and in the air passenger, a person, I can show you now what happened
Here
there.
you are, ribeye medium rare.
A passenger beside the doctor house, he will be in and will be sick, and he will vomit, and I'm showing it now.
Thank you.
Some more Pinot Grigio?
No, I think I will switch to the Syrah.
Sir, are you all right?
He's
You can
corrupt.
see that the patient is developing some symptoms. It's puking.
See?
Malalagnat ka ba? Does anyone speak Korean?
This can happen in the air because the motion sickness affects or any gastrointestinal problems. A single passenger, he can develop some effects of disease of abdomen, and he may start puking. So this is a normal issue or normal disease pattern can occur in the plane.
Is anyone a doctor?
Yes!
What do you want?
Question your motive for agreeing.
Now, in subsequently,
bracelet
I
on
am
his left
going
wrist
to
indicating that
directly
he is allergic
to
to it.
the air part. After some problem that has been seen in such passenger that I have shown, he started puking, he had fever, he developed rash in the body. So they suspected an infection, and also several other passengers also developed such problems. So they thought that it's an congested area of in the air. In air travel, it can cause the infection to spread as fast as possible.
I need help.
Who doesn't?
I need someone to talk to. Close enough. And
So here
you
he
get
is writing
morally
that
outraged at
what are
everything
the
I say.
symptoms
That's
of some of the
permanent marker,
passengers
you
has
know.
developed,
Wow. You guys are
like vomiting,
jet lag.
Didn't explain
fevers, and other
abdominal pain.
problems.
Deep vein thrombosis.
Didn't explain the nausea.
They are
Food
talking
poisoning.
about
What was on
different
the menu?
problems.
Steak and sea bass in first class, fettuccine and seafood kebabs in economy.
Since when does food poisoning cause rash?
Sea bass, seafood kebabs. He had the sea bass. Please tell me she had the kebabs.
I think so.
Chicken.
So here, uh, Dr. House has detected that okay, this is not by infection. This problem is spreading in the passengers through some contamination of the food. They have taken the food, same food, and some passengers have developed same problems from that kebabs or any other food item that he has mentioned. So this problem, and whenever he has told it, he has declared that there was problem in the food. So a panic has started. You know that all the passengers they
As
went
soon
to
as
the
possible.
washroom
Toxic effect should
when
be minimal.
they heard that they have taken the toxic.
Thank you and have a pleasant flight.
Meningococcus makes just as much sense.
I know.
But afterwards, it has been seen after his declaration, there was, in panic-like mood in the whole aircraft. That people started to developing more and more symptoms, like the first person, and they are developing serious symptoms. So, House detected in such cases that no, it's like mass hysteria is going on, that people are just they're becoming panic and they are developing same sort of symptoms.
Give me the meds.
So finally, it was detected that the person, you know, um, who was who had problem at first, he developed the symptoms. It is called a decompression sickness. In decompression sickness, the patient may develop pain in the joint. He may develop some
I'm sorry about your
neurological
cat.
issues and rash in
It
the
was
body.
killing him. Tell the pilot to dive until we can club baby seals out of the window.
We're at 38,000
Thing's
meters.
got the bends.
Diving yesterday. Like an idiot, he surfaced too quickly. And like a bigger idiot, he boarded a flight which is pressurized to 8,000 feet above sea level. Low.
Yeah, Dr. House explained it clearly. The first person who developed the symptoms, he had scuba diving the day before, his flight. So those who are having the diving issues, they are more prone or in risk to develop the decompression sickness. The nitrogen in the body, in blood, they form gas bubbles and they want to come out of the body due to this decompression sickness as he is flying more height above the surface ground at I think 40,000, and I think there may be issues of in cabin pressurization also. So he developed such problems, and this is a severe form that this neurological issue is there. I want to show you the passengers who has developed the problems here. This is the scene. You can see here the passenger. At first, he thought that he should do an operation, but then he
Tighter.
detected that no, this patient has developed joint problem. Yes, this is the issue. This has created uh,
Sorry.
Do that again.
that uh,
Ease off, then
issue
press
that
down.
he has the symptoms of decompression sickness. There's joint pain. Number one, the most common symptom.
Pressure on his joints relieves his pain.
Okay.
Wrong again. Where's his wallet?
And from his wallet,
Boarded a
you
flight
would
which is
understand
pressurized
that
to 8,000 feet above sea
he was a
level.
scuba
Low
diver.
pressure is killing him. Tell the pilot to dive until we can club baby seals out of the window. Get him some oxygen.
So I think I have shown you the problem that decompression sickness can occur in commercial pilot or in commercial plane passengers also who have the risk factors. And treatment is oxygenation. And whenever you will be landed, and after that you will be taken to the chamber, the pressure chamber, you will be given barometric hyperbaric chamber. Will give the patient the pressurized compartment. More pressure will be given in a formulated way, and then he will come out of the problem. It is also an emergency, medical emergency, that can occur in the air. So it was a great learning here. You can see that how the compartment that is congested areas, people can develop some issues like toxin issues. But they can develop mass hysteria, and ultimately it's a common issue that is the decompression sickness that uh, has doctor has diagnosed. So I think this was an interesting case, an interesting thing to share in perspective of the aerospace medicine. So thank you for watching.